Hello, my name is Vincent Murray with Maine Medicare Choices. If you're in northern Maine, we want to make Medicare easy for you. If you're turning 65, you're probably going to get a lot of junk mail and a lot of illegal telemarketing calls. But you still have questions. When do I sign up? Where do I sign up? Are there late enrollment penalties? So skip the hassle and find the Medicare answers you need the easy way with our Medicare Roadmap. You're invited to our Medicare seminar.
Again, my name is Vincent Murray, and I've been helping people with Medicare for the past 10 years, and I absolutely love it because I'm helping people and I get paid for it. It's usually $0. I'm able to help a lot of people without MaineCare, and we look at their plans. There's 6 different companies in Maine and people with MaineCare. So whichever boat you fall into or fall out of, right, we're able to help you. So anyhow, this will be an overview of Medicare. There'll be time for questions and answers at the end of this presentation via email or a phone call. This is usually set up for in person, by the way. All right, for today, topics you indicated that you would like to get assistance with. You're approaching enrollment in the next 6 months, plus approaching enrollment in the next 1 to 3 months. You're already on Medicare and need help understanding your coverage and finding a better plan, or you're already on Medicare and you're interested in Medicare supplements. Topics you indicated you would like assistance with. And that's what we just went over. There are only 6 different Medicare Advantage companies in Maine. We represent all 6 for 2025. This enables us to let you pick whichever plan suits your individual needs the best. A lot of times that's based on your medications. We look those up. Also, do you want more dental, more vision, more hearing? The plans change every year, and so every year we can update you with that information. But for right now, if you're already on Medicare and your plan changed, we understand all 6 plans, and we can help you find the plan that you want. We represent the top Medicare supplement and prescription drug plans as well. United Healthcare is one of those 6 companies, and most of this presentation is a Medicare Made Clear presentation from them. Getting to know Medicare. Medicare Made Clear is brought to you by United Healthcare. What is Medicare? Who can get Medicare? Do I need Medicare if I plan to work past age 65? What does original Medicare cover? Where can I get more coverage? What does Medicare cost? How do I choose Medicare coverage? When can I enroll? When can I change my coverage? And how can I save money and maximize my benefits? What is Medicare? Original Medicare. People make this very difficult, and I know if it's new to you, there's only 4 steps to Medicare: A, B, C, and D. A and B is this red, white, and blue card right in front of you. A is for hospital, B is for medical. C and D is the Medicare Advantage plans we'll talk about later. C covers the A and B, and D is for drugs. And again, we'll repeat that. Medicare is a federal health insurance company paid for through Social Security, funded in part by taxes while you're working. It's individual health insurance. Medicare is not free. Medicare is not a family health plan. Medicare is not Social Security, and Medicare is not Medicaid. Turning 65? How do I get Medicare A and B? If you're collecting Social Security, you should be sent a Medicare card 2 to 3 months before your 65th birthday. They can deduct your Part B premium from your Social Security check. If you aren't collecting Social Security, you can go to the website or call the Bangor office at 877-405-1448. Or you can go to their website at ssa.gov. That's socialsecurityadministration.gov. So ssa.gov/Medicare/sign up. Social Security will bill you every 3 months. When you get your Medicare card, in either case, you can call us and we can compare the plans either over the phone, in person, on Zoom, wherever you're most comfortable. What is Medicaid? In Maine, it's MaineCare or Quimby. Who can get Medicare? U.S. citizens and legal residents. Legal residents must live in the United States for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also meet one of the following requirements: age 65 or older, younger than 65 with a qualifying disability, any age with a diagnosis of end-stage renal disease. Can you have both Medicare and Medicaid? Yes. In fact, that's a lot of times what you see on TV with Joe Namath, talking about all these great benefits. They cannot offer you anything that we cannot offer. I'd like to reiterate that right now. Whether you go through me, I'm a local Medicare agent right here in the Bangor area, whether in Newport, Ellsworth, Holton, Presque Isle, or anywhere in northern Maine, I'm right here. I work. If you have any questions all year long, you can call me. If you have an independent agent you're working with, great, if it's a local agent. What you do not want to do, in my opinion, as an expert in Medicare, been doing this for 10 years, is call the TV to get your health insurance advice. Again, they offer the same things we do, but they're not going to be year-round to pick up the phone and care about your individual situations 365 days a year. And that's what I pride myself in doing. Picking up the phone, call me, any questions you have. If I can't get the answer right, if I'm in a meeting, I'll call you back within an hour or two, if I can. And I will definitely call you back within 24 hours. So rest assured, you're not out there all by yourself. So anyhow, that's what I do. Anyhow, you can have both Medicare and Medicaid. Great benefits. That's the dental, the vision, the hearing, the food cards you hear about, all of that fun stuff. And every plan offers a little bit different benefits. And so if you need hearing aids, that's one plan. If you need more dental, that's another plan. If you're looking for the maximum amount of money on their food card, that depends. And it depends if you're full MaineCare or QMB MaineCare. And that was my phone. Do you know who dislikes telemarketers more than you? Me, because these illegal telemarketers who are calling you constantly, I get your complaints all the time. And I agree. And I empathize with you because I just got one right there. They're illegally calling you. Do not talk to anybody on the phone. Please. Anyhow, so where was I? Dual eligible, both Medicare and Medicaid. 5 of the 6 plans in Maine have special plans and more benefits. They're called DSNP plans, and one of the plans does not. Do I need Medicare if I plan to work past age 65? It depends, is the short answer. And if you're in that situation, I can handle that in a one-on-one conversation. But basically, it's talking to your human resources person. For some people, it's better to stay on your work insurance. For a lot of people, especially if you're the spouse, husband and wife, whoever's working probably gets decent coverage through their employer, but the spouse probably has to pay a higher amount for that same coverage. Even if you have terrific insurance, really terrific insurance, you have probably at least a $1,500 or $3,000 deductible before your insurance kicks in if you're under 65. With Medicare Advantage plans, you don't run into that situation because most plans have no deductibles. What does Medicare cover? Medicare A and B. Medicare A is your hospital insurance. Medicare B is your medical insurance. Part A covers hospital stays with inpatient care. And I'm not going to read on through all of these because I do not recommend just having Medicare A and B. If you have just the red, white, and blue card, Medicare A and B, A is free as long as you've worked 10 years over the course of your life, and B is $185 for 2025. There is also a $1,550 deductible for Part A, and then your 20% kicks in. And there's a $259 deductible for Part B, and then your 20% kicks in. Additionally, there is no maximum out of pocket if you have just Medicare A and B. So we'll go through these on a one-on-one basis because I'm not allowed to go over the individual copays in this presentation or meeting. But if those copays add up to, let's say, $6,700, everything is free for the rest of the year. And $6,700 is a lot of money. But if you're 6 months in the hospital and you have open heart surgery and you have to be flown down to Boston and you have $400,000 bill you're looking at, if you just have Medicare A and B after you pay your deductibles with a $400,000 bill, that is $80,000. That's not the best case scenario. So Medicare Advantage plans will protect you. So we can go over that on a one-on-one basis. That's Medicare A and B. That's your ticket to do everything. So again, it's A, B, C, and D. A and B is your red, white, and blue card. A is free. B is $185. That's your ticket to do either Medicare Advantage plan with a prescription drug plan. D is for drugs. Or you could do a Medicare supplement, and that's around $270, and then everything's covered, except for your Part B premium. If you're just turning 65, not premium, Part B deductible of $259, and then everything's covered. And for $270 per month, you can do that. And then you have to get a separate prescription drug plan. Again, this is just an overview. If I just confused you, we can go over it on a one-on-one basis. But A, B, C, and D. A and B is your red, white, and blue card. A is free, hospital insurance. B is medical insurance, and that's $185 per month. Then you can do a Medicare Advantage plan, or Part C, as you've probably heard it called. That's a Medicare Advantage plan, and D is for drugs. Or you can do A and B, a Medicare supplement, and prescription drugs. All right, so Medicare doesn't cover everything. Original Medicare A and B does not cover all the costs of your care. There is no maximum out of pocket like we were just talking about. It does not include prescription drugs. It does not include routine dental, vision, or hearing care. It does not include eyeglasses, contacts, or hearing aids, long-term custodial care. It does not cover excess charges for services or doctors who do not accept Medicare assignment, and care received outside the U.S. except for certain circumstances near the U.S. border. Medicare coverage choices. Again, Medicare A and B is your ticket to do either a Medicare supplement and a prescription drug plan, or option 2, a Medicare Advantage plan that includes a prescription plan. You are avoiding this $1,632 deductible for Part A and a $263 deductible for Part B if you just had Medicare A and B, and then you'd have the 20%. So as your ticket to do one of these, step number 2, these deductibles go away. Options for more coverage. You can pay up front for that Medicare supplement and then get a prescription drug plan. Or you can pay as you go with a Medicare Advantage plan. And Medicare Advantage plans usually include the prescription drug coverage, Part C and D. Plans will vary in cost. They choose to include and how much. Costs you could pay for a Medicare Advantage plan, low to $0 monthly payment premium. Deductibles. Most plans on a Medicare Advantage plan don't have a deductible for the medical costs. And then you have co-pays and co-insurance. For a prescription drug plan, whether it's a standalone or included in the Medicare Advantage plan, you may or may not have a prescription monthly premium. If you do have a standalone prescription drug plan, there's going to be a higher deductible on tiers 3, 4, and 5, and possibly on tier 2, and the same goes with the Medicare Advantage plan. The deductible is, again, the amount you pay before the plan starts picking it up. Then you have the copay and coinsurance. With a Medicare plan supplement, you have the monthly plan premium of over $200 per month. You have the Part B deductible of $263. And if you're on Plan N, you would have a copay of $20 when you see a doctor or $50 when you go to the emergency room. Medicare cost terms. Premium, that's the amount you pay for coverage on a monthly basis. The deductible we just went over. A copay is a fixed dollar amount at the time you receive a covered service. Coinsurance is a percentage. How much does Medicare cost? We'll go over that in our one-on-one meeting. You decide whether you want a supplement or a Medicare Advantage Part C plan. For Medicare supplements, this helps pay some or all of the out-of-pocket costs not paid for Medicare by Medicare Part A and B. Works with original Medicare and a Part D prescription drug plan. Can't be used to pay for Medicare Advantage costs. Now, there are 10 standardized plans by federal law. What that means is Plan G for one company has to offer the same basic benefits as Plan G for another company. Those are pretty much the two we go over nowadays. It's either Plan N or Plan G, and we'll get to those in a second. Plan F before 2020 was a supplement that included everything for medical. Again, plans with the same letter offer the same basic nationwide benefits. Medicare supplements do not cover prescription drugs, routine dental, vision, or hearing, eyeglasses, contacts, or hearing aids, custodial care, or long-term care. And so here's a look at the different plans. We're going to concentrate on Plan G, Plan N, and Plan F. With the Plan F, you can see 100%, 100%, 100%, 100%, all the way down the line. Everything's covered. The only difference between a Plan F and a Plan G is the annual Part B deductible of $263. And that's, again, for medical. So you'd have a $263 deductible at the beginning of each year. The difference in price between Plan F and Plan G is usually Plan G is about $40 cheaper than Plan F. And the same holds true between Plan G and Plan N. Plan N is about $40 less expensive than Plan G. So again, there's two differences up here with Plan N. You have your annual deductible. Part B excess charges. That usually applies to doctors in larger states. Medicare has a Medicare approved amount, and doctors can charge up to 15% more than that medically approved amount. With Plan G and Plan F, that's 100% covered, even if they charge over the Medicare approved amount. With Plan N, they can charge up to 15% over the amount. So pretty much it's just the deductible, then $20 when you see a doctor, and $50 for an emergency room visit with Plan N. And Plan G is about $40 cheaper than Plan F, and Plan N is about $40 cheaper than Plan G. Fast facts. Must be enrolled in both Medicare Part A and Part B and live in the state where the plan is offered. No medical underwriting up to 6 months after enrolling in Part B at age 65 or older. Means you don't have to answer the questions of pre-existing questions within those first 6 months. nationwide coverage with no provider network, guaranteed renewable as long as you pay your plan premium. And again, you must continue to pay for your Part B premium, whether you do a Medicare supplement or a Medicare Advantage plan. For Medicare Advantage, it's another way to get your Medicare benefits. It's an alternative to original Medicare. You have Part A and Part B, and you keep Part A and Part B. But a Medicare Advantage plan kind of goes over the top, it becomes your primary insurer. And so instead of the deductibles and 20%, you have co-pays with the Medicare Part C. There are 6 different Medicare Advantage plans in Maine. We represent all 6. What we do in our one-on-one meeting is we compare your prescription costs and find out which plan has the lowest cost for you. We look at the overall copays on each plan and help you choose the plan that fits your needs the best. Medicare Advantage. All Medicare Advantage plans cover A and B. Most Medicare Advantage plans include prescription drugs. And again, I'm repeating some of this stuff, but it's good to repeat it. Medicare Advantage plans may offer additional benefits such as dental, vision, hearing, and fitness programs. There are different types of Medicare Advantage plans, and you're probably familiar with these because they're the same type as you're probably on now. With an HMO, you basically go to our doctors, you pay full price. Each insurance plan has a list of contracted doctors, and you go to in-network and you're covered. You go to out-network and you're not out-of-network and you're not covered with an HMO plan. With an HMO POS, that's a point of service plan, you can see an out-of-network doctor. With a preferred provider organization or PPO, they have in-network costs that are lower and out-of-network costs, which are a little bit higher, but you can go to an out-of-network doctor. So you either have regular plans, an HMO, a POS, or a PPO for regular Medicare. If you have both MaineCare and Medicare, or Quimby and Medicare, you have what's called a special needs plan. Dual special needs plans are called DSNPs, and in Southern Maine, you have chronic special needs plans if you have a chronic disease. There are also institutional special needs plans and equivalents. Medicare Advantage cost, usually $0 premium, low copays, and unlike original Medicare A and B, Part C plans are required to have a maximum out of pocket. And what that maximum out of pocket is, the highest amount of money you will have to pay for covered services within a plan year. On Part C plans, your deductibles, your copays, your coinsurance all go towards your Medicare maximum out of pocket. Once you reach this dollar figure, your plan will pay 100% of your covered healthcare costs for the remainder of that plan period for the rest of the year. Fast facts on Medicare Advantage: must be enrolled in both Medicare A and B and live in the plan service area. You cannot be denied coverage based on current financial or health status, including pre-existing conditions. You may be required to use a provider and pharmacy networks. Coverage and costs vary by plan and may change each year. Most copays are very reasonable. Most plans in Maine have a $0 premium, but some charge a monthly plan premium. You have that protection of the maximum out of pocket and prescription drug coverage. Medicare Part D insurance provides coverage for prescription drugs and vaccines. There's 2 ways to get coverage. You can get a standalone prescription drug plan. Usually if you have a supplement, you get a standalone prescription drug plan, or you can get a Medicare Advantage plan that includes prescription drug coverage. Medicare Part D plans cover types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs included in the formulary for that insurance company. Every insurance company has their own formulary. Um, Commercially available vaccines not covered by Part B. Okay, so you have tier levels. As tier number 1 is the least expensive for most plans on a Medicare Advantage plan or a standalone prescription plan, you're going to pay $0 for a tier 1. That's a preferred generic. Tier 2 is a generic drug. And those are $0 on a lot of the plans, especially if you use the mail order program. Tier 3 is when it starts getting a little bit expensive, and that's a copay of a fixed amount. Tier 4 are more expensive, and Tier 5 is even more expensive than that. So we're rooting for tiers 1 and 2, right? I'm sure some of you have prescriptions that are costing you more if you have taken tier 3, 4, or 5. One of the good things that happened 2 years ago is Congress passed the Inflation Reduction Act, and in 2025, this year, on a Medicare Advantage plan or a prescription drug plan, the maximum you can pay is $2,000. After $2,000, your prescription should be $0 for the rest of that plan year. And that's right here. Because of this, more plans do have a deductible phase for your prescription drugs, but then you're in the initial coverage phase after that deductible up to $2,000. I'm not sure if you guys have heard about the donut hole or the coverage gap. That went away this year. This amount here used to be around $4,800 to $6,000. You'd be in your coverage gap where you paid a higher percentage, and then you went into your coverage, your catastrophic coverage. That's not a thing anymore, so that's good. If you're spending a lot of money on prescriptions, you're going to be very happy this is in place. For prescription drug coverage, you must be enrolled in Medicare Part A, Part B, or both. You may be required to use a pharmacy network. Coverage and costs vary by plan, and that's one of the things we do. We just type them into our computer, and we have a list of all the companies, and it will sort it by the lowest prescription cost for the year by the first one that shows up on our computer. And then you look at the other copays. Part D premium penalty for late enrollment, unless you qualify for a special enrollment period. For both Medicare Part B, remember the A and the B, if you don't sign up with B when you're first eligible, you're going to have a penalty. For Medicare Part D, you also have to sign up for a Part D plan, prescription drugs, when you're first eligible, even if you're not taking any medications. With the Medicare Advantage plan, you can get a Medicare Part D that qualifies for this for $0. When can you enroll? For your initial enrollment period, 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. If you're already collecting Social Security, if you plan on collecting Social Security right when you turn 65, they can deduct the Part B premium right from your Social Security. I think we covered this. We definitely covered this on one of our first slides. If you're not receiving Social Security, or if you're currently still working, you could go to ssa.gov/benefits/Medicare to enroll online. Or you can call 877-405-1448. And that's the local Social Security office in Bangor. And for Medicare Advantage, Part C and Part D, that's what we're going to help you with. If you choose to go with a Medicare Advantage plan, again, we represent all 6 plans, and it's a two-way conversation between the two of us, and we try to pick the plan that fits your needs the best. Because we represent all the plans, there's no incentive for us to pick one product over the other. So we're not going to be pushing any particular plan on you. Based on our conversation, we're going to recommend one. And if you want a different one, that's fine with us. General enrollment period. For those who miss their initial enrollment period, you may enroll in Medicare Part A, Part B, or both in January, February, or March. You may choose to enroll in a Medicare Advantage plan or a prescription drug plan. Late enrollment premium penalties may apply. So if you didn't sign up when you were first turned 65, we'll go over the amount of penalty you'll pay for the months or years where you didn't have Part B or Part D. Medicare supplement open enrollment period. 6 months after the date of your birthday. Lasts for 6 months beginning the month in which you are 65 or older and enrolled in both Medicare Part A and Part B. No medical underwriting if you enroll during this time. You may apply at other times, but you could be denied coverage or charged a higher premium based on your health history. Some states have additional open enrollment rights under state law. Special enrollment period for those working past age 65. For those who delayed enrollment with creditable employer coverage, you will have an 8-month window to enroll in Part A and Part B after your employer coverage ends. You will only have the first 2 months to enroll in a Medicare Advantage plan or prescription drug plan. And you have exactly 63 days to get a standalone prescription drug plan or Medicare Advantage plan without a penalty. So if your employer coverage is ending, yes, you have a large window here for Medicare A and B. Again, you need A and B before you can do C and D. So time is of the essence if you don't want to have to wait until October 15th to December 7th, the annual election period. Late enrollment premiums and penalties. If you qualify for premium-free Part A, you'll get that when you first turn 65. Part B, you have the choice of getting if you're still on employer coverage. But if you don't have creditable coverage, there is a penalty. And again, if you have work insurance, more than likely that's credible. You can check that out with your HR department. But if you don't have Part B and you don't have work insurance, there is a 10% of the monthly Part B premium amount for each full 12-month period enrollment is delayed. So real quick, if it's $185 for Part B and you waited 12 months and you're just applying for Medicare, then there would be $185 times 10% added to your monthly plan premium. For Medicare Part D, the penalty is an additional 1% of the average Part D for each month delayed. So if the average is $40 for a prescription drug plan, you'd pay 40 cents per month for each month you didn't have a prescription drug plan. So at the end of the year, that'd be 40 times 12 or $4.80. That's a ballpark. We're not allowed to quote the exact amount. Added to your Part D premium of usually $0. So you'd have that penalty of $48 for the rest of your life. And again, I'm going kind of quick over all this. This is an overview. We can slow this down and attack each specific. Everyone's different. Everyone has different circumstances. If this doesn't apply to you, I would not stress about it. When can I change my coverage? October 15th to December 7th is your annual election period. January, February, and March. Right now, if you're already on a Medicare Advantage plan, you can switch to another Medicare Advantage plan. Special enrollment periods. So if you move outside the plan's coverage area, you have what's called a special election period. In most cases, you'll have 2 months after the month of a qualifying event to make plan changes. During this time, you may join, change, or drop Medicare Advantage or prescription drug plans outside of the Medicare annual enrollment period without a penalty. Here's a good question. How can I save money? It's a great question. I'm glad you asked. Use your benefits wisely. Use preventive services. A lot of these plans will pay you to do a certain procedure, to get your annual wellness check. They'll, and it's different with every plan. They may pay you an amount for doing a preventive service, getting a mammogram, annual wellness check, and so on. And those will be listed in your summary of benefits. Use your plan's provider network. Try to go to an in-network doctor. Ask about generic and low-tier prescription drugs. Use the plan's preferred pharmacy. It's usually least expensive when you use the mail order program with all these plans. Understand the status of your hospital. Financial assistance programs. You have extra help, Medicaid, and the Medicare Savings Program. I will let you know that this changed as of July 1st, 2024. They increased the amount you can make and still get extra help from the state of Maine, QMBY, up to $2,321 per month. So if you think you might qualify for that, I don't work for the state of Maine, but I can get you an application or help you enroll in the Medicare Savings Program.